Hey, this is Rick Kaselj, injury specialist from exercisesforinjuries.com. In today's video, I'm going to go through how to fix chronic knee pain. So a lot of times with my clients, what they've gotten is they've gotten some sort of knee pain diagnosis and they wonder what they should do next. What are the knee pain exercises and stretches that they should focus in on? You know, what are some of the knee pain treatments they can do at home, and what are the exercises that are going to provide them from knee pain relief? And I'm going to go through that in this video. So what I end up starting off people with is really the three knee pain treatments that you can end up doing at home that'll immediately help relieve your knee pain. And the first thing is decrease unnecessary stress. So the more load that you end up putting on your knee, you end up putting unnecessary stress, so it doesn't allow the knee to recover and heal. So positions of stress end up being like standing. Also, the more that you end up bending the knee, the more stress that you end up putting on the knee. So if you don't have to stand, if you don't have to bend your knees, then don't put that unnecessary stress. It'll allow the knee to recover and heal. The second thing is to ice the knee. Get off your feet, lie down or sit down with your knee in a straight position or just slightly bent, and then ice it, especially after activity, a long time standing, a lot of walking. Ice the knee for 10 to 15 minutes to allow the knee to, the ice ends up helping relieve pain and also ends up decreasing inflammation so that knee can end up healing and recovering. Now, the third thing that you should end up doing when it comes to knee pain treatment at home is to keep working on the range of motion and movement in that knee. And I'm going to get Alex to demonstrate. So with this one, what you're doing is you're having a seat. So you're having a seat, Alex. And so we're offloading. So we're not standing, we're offloading, so there's less stress on the knee. And what we want to do is we want to work on that range of motion or movement in that knee. So we can end up going through like straightening the knee out, so having the heel, straightening it out as much as you can, and then bringing that heel back and trying to work on that range of motion of the knee. So straightening and bending it back. Then you can end up progressing to bringing that knee up towards your chest so that we're working on that range of motion in the knee. And with each of those, I would just end up going like 5 repetitions, smooth and controlled movement. Pick whichever one is most comfortable for you to do. You can start with the sitting, bringing the heel back. When that's easy, then you can go to that knee to chest one. Because what we want to do is we want to maintain that range of motion in that knee. We don't want the knee to lose that range of motion and to end up getting stiff, because that'll end up affecting when it comes to recovering from knee pain and healing and recovering from that knee. So those end up being where I end up starting people off, those 3 knee pain treatments at home that they can end up doing. Then we end up going into not the stretching and exercises, I end up focusing in on massage. So I wanted to go through the number 1 knee pain massage exercise that I recommend people doing. Now, you can see with Alex, she's moving down to the floor, and what we have is super duper tennis ball. So this is a dog ball that you can get at the dollar store. It's like it's firm, and it ends up being about $1 or $2, and it ends up being excellent for self-massage and to massage out the quadricep area. So I know you might be having difficulty getting down to the floor, and I'll answer what to do about that after Alex goes through this one. So you're lying down, you're almost in a plank position. You're going to move that ball, up to your hip, just below your hip, and then you're gonna roll up to just above your knee, and you're gonna go through that whole quadricep area. So you're gonna go up and down the middle part of the quadricep, out to the side, and more towards the middle, and you're going about 5 repetitions up and down. Up and down is 1 repetition, and then you're gonna stop, and then you're gonna see how that quadricep feels. Does it feel looser? Does it feel not as tight? Does it feel like you've got a bit of a massage from the exercise? And then you can end up progressing to 10 repetitions. Now, I know, everyone's knee pain ends up varying. You might not be able to get down on the mat. And so I wanted to show you what you can do when it comes to sitting in the chair. So what you can do is you can sit in the chair, and we'll do the right leg, and you end up straightening this right leg, good, and then you would end up using your hand. So you're pushing into the ball, and you're rolling the ball up and down that leg. So if you're not able to get down to the ground, or it's difficult for you to get up and down from the ground, you can end up doing this sitting nice and upright, and then going through that massage through that quad area. So that ends up being like the #1 knee pain massage exercise. So I would do this before I end up getting into the stretches and the exercises. Now, after the massage exercise, we end up moving to, the 2 knee pain stretches that I end up recommending. So the first one ends up being a standing hip flexor stretch. So you're standing, you can have the hand against the wall to kind of eliminate balance, because we want to really focus on the stretch. And what Alex says here, she's taking a big step forward, she's flat in the front foot, she's on the balls of the foot on the back foot, both legs are straight ahead, and she's going to tighten up her abdominal area, she's going to bring her hips forward, and then she's looking for a light stretch in that thigh area and even up into the hip. So what oftentimes happens with knee pain is there ends up being tightness in the quadriceps and in that hip flexor area. And that tightness ends up having really slow and light pulling on that knee. And that slow and light pulling ends up leading to more knee pain, progressing knee pain, and it prevents that healing and recovering that you want when it comes to a knee injury or knee pain. Now, how long you're going to hold that stretch, I'm looking for 20 seconds. Light stretch, and we're going to do it on both sides. So you can alternate back and forth. So even if you have the knee pain on one side, I would recommend going through it on both sides. Now the second one ends up being a quad stretch. So I would end up doing this in standing, good. You're going to bring the heel towards the seat, and then you're going to end up bringing that knee back a little bit more, and that'll end up targeting the hip flexors a little bit more. So we're standing, nice good upright posture, hands up against the wall in order to eliminate balance. Okay, and you can have that knee a little bit forward. If you feel a strong stretch just in that position, if you're not feeling much, you can bring it back, and that targets the hip flexors a little bit more. Now, if you can't do this, you have too much knee pain, you can't get into this knee bending position, what you can end up doing is, so I'm gonna get you to stand on one leg, and you're just gonna bend the knee to whatever level you can, and then you're gonna bring it back. Okay, you're going to push it back. So now what we're doing is working whatever range we can and bringing that leg back. We're working that hip flexor. We're stretching out that hip flexor, which oftentimes ends up being tight in people that end up having knee pain. So that's where I would end up starting people off. So before we end up going into the main exercises that I end up getting people. So get that diagnosis. Look at doing those 3 pain treatments at home, do the knee pain massage exercise, and do the stretching exercise, and then we move into the main knee pain exercises. Okay, so now what we're going to do is we're going to end up moving into the 3 knee pain exercises that I end up recommending people to do. And usually I give 2 options for each of them, but there ends up being 3 main exercises that you should end up doing for your chronic knee pain. So the first one ends up being a wall plank, and Alex is going to demonstrate. So you're finding a wall, you're going to come into that plank position, and then you're going to line your body into a nice straight line. So you're on the forearms, elbows are just touch below shoulders, your head, shoulders, hips, legs, and ankles are on a nice straight line. You're going to hold that position for like 5 seconds, and then you can step back into that standing position, take a rest, and then you can end up going back into that plank position. So you're starting off with 5 seconds, you're going to end up doing 5 repetitions, and now you might be asking like, hey, why am I doing this? Why am I doing like an abdominal core exercise for my knee? What they found is people with knee pain oftentimes ended up having poor core stability, abdominal strength. And with that poor abdominal strength and core strength, it ended up leading to making their knee pain worse. So what we're working on is strengthening up that core, which also strengthens up the hip, and that ends up helping when it comes to less stress on the knee, allowing for a decrease in knee pain and allowing for your knee to recover. Now with this wall plank, you can progress it. So we can end up going into that wall plank and we can start adding leg kicks. So you just bring the leg back from like 0 degrees to about 45, yeah, and then back, and then the other side. And what I say is you end up doing like 5 repetitions on each side, so a total of 10. And what we're trying to do is just have that movement happen in the hip. The low back's not changing. Everything else is in good alignment. Forearms, elbows below the shoulders, tighten that abdominal area, bringing that leg back, and just that hip ends up moving. And with this one, we end up challenging the core more, but then we also challenge the stability in the hip. So a lot of people end up being weak in the hip, and that weakness ends up putting more stress on the knee, injuring the knee and leading to more knee pain. So that ends up being the first knee pain exercise I would recommend. Wall planks or wall planks with leg kicks. Now the second one ends up being a vertical shin squat. Now I can end up using the door frame to do this exercise, but what we're going to end up utilizing is a suspension trainer so that you can end up seeing it better. But at home you can just end up using the door frame. And then what Alex is doing, she's got the suspension trainer, she's putting her weight back, and what she's trying to do is squat down and really keep that shin vertical. There we go. Good. Vertical, and then coming back down. I want her to build to a point where she's bringing the hips just below the knees. Good. And then back up. So with the vertical shin, it puts the least amount of stress on the knee when it comes to that squatting position. So that's why we end up doing the vertical shin. And then also we have our weight back, so it's more back on our heels. So we end up targeting the hamstrings and the glutes a lot more and a lot less the quads. Good, perfect. So you can just use the suspension trainer to do that, or you can end up grabbing the door frame and doing that. Now, oftentimes when I get people to do that exercise, what they'll end up saying is, well, I get knee pain with squatting, and what should I end up doing? Well, make sure that you're doing the vertical shin. The shin's vertical when doing the exercise. Now, the second thing is there's 2 little tweaks that you can end up doing if squatting ends up bothering you. So the first one ends up being just bringing the feet a little bit further apart. So if your feet are narrow, so get you bring narrow, and then going through a squatting movement, it ends up putting a lot more stress on the knee, and you can see Alex really has to lean forward in order to go through that movement. The more she leans forward, the more stress it puts on the knees. If she can go with a wider stance and go into that squatting movement, good. She doesn't have to lean. She doesn't have to lean as much forward when going through the movement. Good. So she's able to have her weight a little bit more back. So that ends up being the first tip if you have pain. Well, kind of second tip. First tip is try to keep that shin vertical. The second one ends up being bringing the feet a little bit further apart and the toeing out a little bit. Now the third tip ends up being try to keep that weight back. So Alex, I'll get you to kind of go through a squat with with most of your weight on your toes. So that ends up putting a lot of stress on the knee joint. So it works the quads, and then the quads are really pulling on the knee joint, irritating the knee, increasing the risk of a knee injury, and kind of making knee pain worse. What we want to do is keep that weight on the middle of the foot or even back on that foot. What that ends up doing is it focuses more on the hamstrings, less on the quads, and then it also focuses more on the glutes, gluteus maximus. So try those 3 little tweaks: vertical shin, feet a little bit wider apart, and then weight back on the midfoot or the heel if you end up having pain when it comes to squatting. Now, going into that last exercise, that last knee pain exercise that I recommend, it ends up kind of being an extension of the wall plank, specifically the wall plank with leg kicks. So with this one, what we're going to do is like a single leg standing or single leg balance. So Alex is going to stand on one leg. So with the standing on one leg, you can start off with your hand up against the wall because we want to eliminate balance, because what we're just trying to focus in on is get the technique perfect. Then we can take the hand away from some support like the wall. Good. So Alex has got weight even on the foot, slight bend in the knee, and then she's just going to hold that position. We're looking at holding it for a period of time. At the start for you, it might just be like 5 seconds, but then you can progress to about 30 seconds and going through like 5 repetitions. So we're really working on the stability in the ankle, stability in the knee, and then really in that stability of the hip, because a lot of people, especially runners, will end up having weakness in the hip, and that ends up putting unnecessary stress on the knee, leading to knee pain. Now we can progress this one, and we can do an exercise that I end up calling the falling helicopter, which is a progression of this where you're going to drop that hip, good, and then you're going to come back up, good. Dropping that hip, good, and coming back up, excellent. So you're got weight even on the foot, knees bent, you're going to bend in the knee, you're going to bend in the hip, you're going to drop the opposite hip, this pops this hip out, and then you're going to come up and go back to square. So we're really, with that dropping of the hip and then bringing it back to square, we're really working on that hip stability, which is important when it comes to recovering from knee pain. And it's also a common thing that you'll end up seeing with people that run that have knee pain from running. They end up being weak in the hip, they have weak stability in the hip, and this ends up being an excellent exercise for that, not just for runners, but for anyone that ends up having knee pain. Perfect. So there you go. That ends up being like a comprehensive insight on how to fix chronic knee pain. Now, if you like this video and are looking for a couple more of my tricks when it comes to overcoming knee pain, then what I recommend you do is click right here. I have a free new report called 5 Tricks That Fight Knee Pain and Tightness. Just click here, let me know where to send it, and I'll send it to you right away. Now, if you're watching this on a mobile device like a smartphone or a tablet, head down below into the description and click the first link, which will end up being exercisesforinjuries.com/knees. Let me know where to send that report, and I'll send you that report right away. If you like this video, make sure to like it, hit like. If there's something else that I can end up helping you with when it comes to knee pain or other injuries that you end up having, leave the question in the comments section. Plus, if you want future pain relieving videos, and exercises, then make sure to subscribe to my channel.